Hello, my name is Julie Ramirez. I'm doing Biology 225 and we're on the 8th week and I'm doing the presentation. I went ahead and picked the what is a strep throat. Usually a strep throat is caused by bacteria. It's due from either an infection that is called the Streptococcus. Strep throat makes your throat feel very sore. It's painful when you're eating and swallowing. Now, I went ahead and did a case study on an example on a patient. I have a person named David Gonzalez, who is a 28-year-old patient male. His occupation, he is a janitor. He has no history of past medical conditions. David has been reporting that he's been experiencing painful in the throat and having a lot of thirsty. And he hasn't been able to eat or drink as well because of the pain when he is eating his drinks or meals. This patient's also complaining of a fever. His fever is 102. Again, he's having difficulty with pain, swallowing, no cough, no nasal congestion, just feeling very fatigued. He's also feeling symptoms of swollen and tender lymph nodes in the neck area. Due to this, it's irritable to the tonsils. It can cause white pus in the tonsils. For this method, you would have to use a swab, which is called a throat swab. And what this does, it checks for any group of a Streptococcus bacteria, which is a primary cause of strep throat. What this usually results is that it can either pick up a positive swab for bacteria in the throat, or it can also pick up just a negative result, which is most likely due to a virus instead of bacteria in the throat when it's positive. The interpretation for this and diagnosis, usually the test performed, they would do a Gram stain, which checks for bacteria for positive or round shapes. Also, they do a catalyst test, which can help distinguish if the test is positive or negative for Staphylococcus. Also, there's another test called coagulase test, which can confirm if there's any presence of Staphylococcus aureus. I believe that's how it's pronounced. Also, they have the blood agar, which is the hemolysis shown by, bacteria that breaks down the red cells. And also antibiotics, who they also use for susceptibility to confirm that the methicillin sensitive to staphylococcus. So usually patients with this, again, the symptoms are fever, swelling, redness, and pus, and also infection on the site. The treatment, again, for this patient would be draining the abscess first, discarding the pus or diminish the pressure. Antibiotics can be started orally, such as cephalexin 500 milligrams. Normally is taken 4 times a day for 7 to 10 days. If the infection worsens, then intravenous antibiotics will be most likely needed, which would be the ceftriaxone. Now, usually the expectation of this outcome is that the patient would, within 10 to 14 days, the symptoms like the redness and the swelling should slow down. The abscess should heal with, proper treatment. But again, this is for my study for sore throat. It could be related to a viral tonsillitis, strep throat, or quinsy abscess, depending Usually with the case studies and the test performed with the oral swabs will determine what kind of virus or bacteria you have developed, and then treatment will be taken in place by the physician depending on the results. So thank you again. That is my presentation, and have a great holiday. Thank you. Bye-bye.